Council Member Randy Christian and Lubbock Mayor Dan Pope. So let's kick things off with Catherine Wells.
Good day, everyone. I want to update you on our current numbers of COVID-19 cases in Lubbock County and all of the ongoing activities of the City of Lubbock Health Department. The department is reporting 592 cases as of yesterday evening, that's May 10th. The department is pleased to see the number of cases continue to be low. As I said last week, although the number of cases has remained steady, it is still too early to determine if the opening of businesses and increased movement among our residents has impacted the local number of cases. It will take around 7 days for someone to develop symptoms of COVID-19, and then it may be another 3 or 4 days before they decide to get tested and the results come into the health department. At the earliest, we will begin to see the effect of the openings in the health department numbers this week. However, it will be a few weeks before the department has enough data to show if the Lubbock community can keep our numbers down with these changes. The department continues to report recoveries each day. There are currently 308 recovered individuals in Lubbock. The health department uses the CDC symptom-based strategy to determine when someone is recovered. For the majority of the population, this is the recommended method, and a negative test is not required to return to most workplaces. Unfortunately, we have reported 49 deaths in Lubbock County. The department wants to point out that only one of the last 7 fatalities in Lubbock are associated with a nursing home. This is very different than what we saw earlier in this outbreak. These individuals were exposed to the virus through contact with an individual in the community, which could have been an asymptomatic carrier, a caretaker in their home, or a family member. This is why we need to continue to limit social gatherings, practice social distancing, wear a face covering when we're out in public, and follow good hygiene practices. We can all do this together if we can follow these guidelines. I'll now turn things over to Dr. Cook. Thank you.
Thank you, Catherine. I appreciate that. What a beautiful weekend it was to celebrate our mothers and all the things that they have done for us and how they and what they mean to us. It was just a beautiful weekend. You know, let me reiterate what Catherine said about asymptomatic carriers. As she mentioned, the last few deaths that have been associated with COVID-19 in our city have been associated with people that it's community spread. So asymptomatic carriers. So again, please, if you care about somebody, and I know that you do, and you care about other citizens in this community, make sure that you wear your masks and that you wash your hands and that you keep that social distancing, and make sure that you do a good job of disinfecting all those surfaces that you touch or maybe other people touch and don't have the personal hygiene that you might have on those surfaces. So just be careful. And again, just make sure you keep your social distancing, because now we're starting to see that spread in the community. So I think we're doing a good job. We can't give up our vigilance and diligence to make sure that we continue to stop the spread of this virus. You know, I think we may hear later on in the week, and as Texas starts to open up, I want to talk to you a little bit about travel. The CDC still recommends that there are some places that we don't travel to. And actually it says recommends avoid all non-essential travel to things outside the United States like China, Iran, most European countries, and United Kingdom and Ireland. If you travel to those places, I'm sure Customs is going to ask you to fill out a form and that says you're going to self-isolate or quarantine yourself for the next 14 days. And so if you travel outside the United States, that may very well happen. There are certain cities in the United States that Governor Perry says recommends that you should not travel to. And if you travel to the following cities, you're going to have to self-isolate or self-quarantine yourself. And the Department of Public Safety also has a form that you need to fill out. And those cities or those states, we'll start with the states first. Those states are New York, New Jersey, Connecticut, California, and the state of Washington. And so let me repeat those. That's New York, New Jersey, Connecticut, California, and the state of Washington. There are cities also that the governor says that if you fly in or travel to and return to Texas from, that you need to self-quarantine and isolate yourself for the 14 days. That's Atlanta, Chicago, Detroit, and Miami. I'll repeat those: Atlanta, Chicago, Detroit, and Miami. So if you go to one of those states, one of those countries, or one of those cities, you're going to need to self-isolate. I think this is good news that we're starting to open up, but please, we must be diligent and vigilant in our fight against spreading this virus. I hear that, some people are getting tested, and when you get tested, please stay away from other people. Do all the things that we've talked about until you get your test results back. Either you are a known contact to somebody and that you could be spreading the virus, or that you are having the symptoms of the virus. And so if you're in those two categories, please self-isolate yourself until your test results come back. Because we absolutely know that there are asymptomatic carriers. And so good job so far, Lubbock, on all the things that you've done. We're seeing our numbers come down. We still have a few days to go before we really see if we've made a difference. Hang in there. We're doing a good job. That's all that I have. And Lacey, it's back to you. Thank you.
Thank you, Dr. Cook. And now we welcome District 5 City Council Member Randy Christian.
Thanks, Lacey. I appreciate the opportunity to weigh in on COVID-19 and our battle against it. But first of all, I want to say a big salute to Catherine Wells and her team for doing an incredible job from the day one that COVID-19 became a part of our lives, and as well as Dr. Cook and everything that he's done to this point too. But I'm going to leave all those statistics to them, but I just want to talk a little bit about the idea that I truly believe that we've based upon the information we got months ago, that we've been doing the right thing, and we continue to do the right thing as far as trying to negate COVID-19 in our communities. And as all of y'all know, that today, May 11th, is a day that was very significant in the history of our city when the tornado devastated our city. But unlike COVID-19, we could see that tornado. We can't see COVID-19. And it's everywhere. We have to be honest. If you listen to what Dr. Cook and Catherine said just a few minutes ago, it is highly contagious. And we've got to recognize that fact. And it's going to be with us for months, and I hope not years. But, whatever its duration, we got to fight this thing together. It is the common enemy for all of us that's made a lot of citizens sick, and it caused the death of a lot of citizens as well. But the thing that I've seen over the last month and a half or so, that this COVID-19 has also divided our community in ways that's really bothersome to me. We can have healthy debate, and I encourage citizens to push back on different things, but I still strongly believe that as West Texans, there will always be more that unites us instead of divides us, especially when it comes to COVID-19. And, thank goodness that we're moving towards opening up our city and our state and towards that 100% mark. But we've got a long ways to go. So we've got to listen to Dr. Cook and Catherine about what we need to do to defend ourselves and our family members from COVID-19. I'm very proud of the Lubbock Safe program, in my opinion, and I think it's an envy of the cities across the state. But the reality is our governor holds the key to that 100% open mark, and I hope and pray that we get there soon. But I also know that there's a lot of elements in our country and our world that would love to see nothing more than for our reopening of America to fail and our economy be destroyed. You know, the tornado destroyed our town 50 years ago, but back then our citizens came together and turned that devastation into this dynamic city that we love so much. I still believe the future of Lubbock is incredibly bright. And I think that some of the horrific effects that the COVID-19 has had on major metropolitan areas, both in our state and in our country, that I think there's going to be a lot of people of all ages and businesses large and small are going to be looking feverishly to locate to places like Lubbock, Texas. I think we could have, in the next 3 to 5 years, have another serious growth spurt with our city. But we also have to be real honest with ourselves, and I put myself in this category that we're somewhat spoiled rotten by our second to none quality of life. And there's a lot of folks that are looking for places like Lubbock, Texas to call home. They're looking for us, and they're going to find us. But regardless of how big we grow or any growth that we have or prosperity, I don't want it to dilute our beloved West Texas spirit and heritage and values. In my opinion, Will, I encouraged us to have debate, and like all families, we'll always argue, debate, and have strong differences of opinion. But when the dust settles, I think the mayor would agree. We'll all grab a cold beverage, get some great barbecue, and enjoy our spectacular sunsets. They're just a few of the many things that bind us together as West Texans. So let's whip this COVID-19 together, and God bless Lubbock and God bless West Texas. Mr. Mayor, it's all yours.
Councilman, thank you. Thanks for sharing with us. We really appreciate your perspective, and I tend to agree with you. I want to start this morning by just pausing and expressing my feelings and both my thanks and my condolences. My thanks to the men and women who serve on the front lines as healthcare workers and are making certain that our food supply is sufficient. Those that are emptying our dumpsters and making sure that we're safe. Also, I'm in thought about our families that have been impacted by deaths around COVID-19. And I feel for our businesses that have been impacted, significantly impacted. Like Councilman Christian, I think about that Monday 50 years ago when the Lubbock tornado hit. And I hope this evening that at 6:55, you'll be able to hear our church bells community-wide ringing 26 times in memory of those Lubbock lives lost. At 9:45 tonight, we're asking all of you to turn on your front porch lights. That's when the big tornado hit. Texas Tech will be doing a special event. You'll be able to follow that on social media tonight. They'll be ringing their bells and dimming their lights. So please try to follow that. I'm encouraged by some stats. First of all, more than 600 businesses have signed up for Lubbock Safe. And if you'll allow me to share my screen with you, you'll see that we continue to follow a few key metrics, active cases on a daily basis. You can see that the trend remains positive here. Our new cases day to day. So we're now, it's been, well, the entire month. It's not since April have we had a day with more than 10 new cases. Finally, our hospital data, what kind of capacity do our hospitals have? You see it remains very, very strong. And finally, our new cases today by day, the red line contrasted to the total testing that's being done. Remember that yesterday on a Sunday, a Mother's Day, we didn't do much testing, but those new cases as a percentage of overall tests continue to go down. Okay, sorry, I don't do that very quickly. So data continues to drive our decisions. We want the very best science and information. We need a safe environment. We need to provide safety for the people that we love. And we deserve the personal freedoms that we cherish as Americans. I believe it's safe to get out. We can do it in a way that doesn't put us in danger. I intentionally ate out in our restaurants last week. I found very safe, welcoming environments. I don't believe it's safety or business. I think it's safety right now allows businesses to open. I'm hopeful. I see a recovery much like 50 years ago. Always remember that West Texas spirit. Remember the energy and the ingenuity and the fresh thinking of the people in our community. Those business owners that are looking to return to profitability while at the same time focusing on employee health and the safety of their customers. Don't bet against the United States, and certainly do not bet against Lubbock, Texas. Be safe, be kind, and be hopeful. Lacey, it's back to you.
Thank you, Mayor. And I'm going to ask all the panelists to turn their videos back on. Okay, we're going to open it up for media questions. And here is our media order for today. Matt Dotre, Avalanche Journal, Christy Martinez Garcia, Latino Lubbock, Karen O'Kay with KCBD, Tori McGee with Fox 34, Matthew Still, KMAC, Terry Furman, KLBK, Sarah Self-Walbert, Texas Tech Public Media, and Olga Aguero with El Editor. So let's get things started with Matt Dotre.
Hey, everyone. Ms. Wells, have you gotten any results from the antibody tests yet? And are you seeing any information from that?
I haven't received any official antibody test results yet. We're still looking at that, and the state's has released some additional information about how those get counted in our numbers. So we're still working through those new definitions.
But the tests that Covenant started administering, has the health department gotten any results from those?
They told us that it was going to be about 3 or 4 days before any results were received. And I think that just started last Friday.
Okay.
If I'm correct.
Okay. And then Mayor Pope and Councilman Christian, you know, there's just a lot of talk about people moving around in the city. And Mayor, you said you want to provide for a safe environment. Can you just comment on face masks? I'm wondering why it's not mandatory for people to wear face masks in Lubbock.
Randy, why don't you start, and I'll go after you.
Well, I think that I've pretty well voiced my opinion on face masks early on into this problem, and you know, I've been suggested I feel that we should demand a face mask, but I'm not there yet. But I do believe that it just is common sense for us to wear face masks, especially in high risk areas where there's a lot of people that are around us. That it's not that we're not asking people to, you know, eat broccoli. We're just asking them to wear a mask where it's appropriate, and it's really protecting. Let's just take one of the reasons I wear a mask primarily, so I can protect other people that are around me, because an errant cough, an errant sneeze, it's caught. Now, there's some masks that'll do a better job, like an N95s that I wear when I fly back and forth to Houston when I'm taking my cancer treatments. But I just don't get it. I don't get this strong pushback and avoidance to say that that we're trampling on people's rights by encouraging them to wear a mask in places that it makes sense. I went walking several times this weekend. I don't wear a mask when I'm walking through my neighborhoods because I want to breathe some fresh air and that sort of things. But when I go to the store or I go somewhere else, I'm going to put that mask on, and I just don't get it. So, to Matt, to answer your question, I just don't understand this hard pushback of wearing a mask. It's to protect each other and protect our family. And as Dr. Cook said a number of times, and especially when we have asymptomatic people, you're protecting the younger people, protecting your parents and your grandparents from infection. And I think that's just a sign. To me, that's a sign of love and concern for your family members.
Yeah, thanks, Randy. Matt, I trust Lubbock people to do the right thing. We've given them the information they need. They understand the significance and the importance of face coverings. I don't believe it's our job to mandate something like that. And that continues to be my position. Let's take care of ourselves. Let's take care of our neighbor.
Thank you, Matt. Now we have Christy Martinez Garcia with Latino Lubbock.
Good afternoon, everybody. I'm Christy with Latino Lubbock magazine, and I want to thank you all, especially Randy. I'm so glad you're here today. It's been good to see you and hear your words of wisdom. I agree that Catherine and her team have done an amazing job, so thank you to them. The White House is now experiencing staff with COVID-19, as we all know, and what I want to know today is, have there been any city employees, I don't mean just in the immediate working with council, I mean any city employees that have contracted the virus, because they are out there working, and I'd like to know if they're protected and if we've seen any cases among them.
I think Catherine can best answer that question, Ms. Wells.
And I don't have specifics on city employees, but they follow the same guidelines that we do for anybody in any workforce. So if city employees' families exposed or test positive, they have to go home on that 14-day quarantine. We work hard to get them tested, just like we do with any other citizen. And our goal is to protect all Lubbock employees and everybody in our community.
Awesome. Now we know that it takes a few weeks after openings to see a resurgence. Are there still enough tests in preparation? And for those that have recovered from COVID-19, are they being retested sequentially? Because we have someone who reached out to us and is still having issues with this.
I'll go ahead and take the testing question. We continue to have more and more testing capability. We see more and more providers' offices in our community that can test. Plus we have the different drive-through locations. Dr. Cook, are you able to take the question about retesting?
Well, retesting, we're not routinely retesting any individuals in particular. So I think Catherine answered that question well. So.
Thank you, Christy. Now we have Karen McKay with KCBD.
Good morning.
Morning.
Dr. Cook, you talked about self-isolating if you go to other countries or other areas where in the United States where it's a concern. What about in Texas? What about people who want to go see family in Amarillo or Dallas or Houston where we've heard there are some high cases? What advice do you have there? Do we need to self-quarantine when we come home from certain places in Texas?
So, Karen, you're a little difficult to hear. I think you said if somebody travels to Houston or Dallas with a high incidence of disease, it's
Amarillo.
Or Amarillo, certainly. I don't. Governor Perry does not have that on the website, on the Department of Public Safety website as a listed city. Common sense would tell you, I probably shouldn't travel there yet. We can't make rules and guidelines from everybody. It's just common sense would say, I probably shouldn't go to that area unless I absolutely need to. If you choose to go there, I would strongly recommend that you certainly do some significant self-monitoring if you do go to those areas.
And Mayor Pope, you've talked about you're really watching these the graph for the active and new cases, which seem to have almost flatlined, which is really good news. So looking at these virtual news conferences, how much longer do you see us having these live news conferences twice a week? Are you considering pulling back on those or changing them in any way?
Yeah, great question, Karen, and thanks for your comments. I think we read the data very similarly. I think we will reconsider our communication strategy soon. It's very important that we continue to tell the story, and we really appreciate you guys helping us tell the story. It gets the news to our citizens, and we want a safe environment, Karen. We I believe, have addressed this very well as a community. And part of that strategy of attacking this virus is making certain that this remains top of mind for our citizens.
Thank you, Karen. Now we have Tori McGee with Fox 34.
Good afternoon, everyone. Mayor Pope, there was a joint letter from several Texas mayors across the state asking the federal government for more assistance. Can you follow up on that, and what type of federal assistance are you asking for our city?
Yeah, Tori, I'm really glad you asked the question. So the CARES Act, that Congress passed very first couple of days of April, included $150 billion for cities and counties around the country. Texas got 11 point something billion of that. If you were a city or a county over 500,000 people, that money went to you directly. It was wired into your account. They've had that money now for 17 days. They got it Thursday, 3 weeks ago. If you were a community or county under 500,000 people, like Lubbock, City of Lubbock, Lubbock County, the money went to the governor's office for distribution to the state. Our letter encouraged the governor to get us our money. That money can be used for grants to businesses. It can be used for testing. It's for public health. It can be used for many of the items that we are using or involved in today, as well as some things like mortgage assistance and grants for the smallest of business, those 1 and 2 person shops that have fallen in the cracks. So that's what we asked for. We have not heard anything from the governor. We'll talk to him this afternoon late. Maybe he will illuminate us.
Thank you, Mayor. That's all I have.
Thanks, Tori.
Thank you, Tori. Okay, now we have Matthew Stell with KMAC.
Thanks so much, Lacey. My first question is for Catherine Wells. Catherine, you mentioned that only one of the last 7 deaths were at a nursing home, but the other ones were at places, or that particular person got them from community exposure, somebody they had contact with. Is there any way that we will get a list of those places? Have we already got a list of those places and know where that community exposure contact, where that happened at?
It's not community exposure like being out in public somewhere. It's being in either out and about or a family member. So there isn't really a place to say everybody was exposed. We were able to track down those individuals.
Okay, gotcha. Thank you. My second question is for Mayor Pope. Mayor, I saw just this past week, the city of Dallas had to furlough about 500 city employees. And so they just can't afford to pay those employees because they aren't getting the sales tax revenue that they're usually getting. Can you tell us how the city is doing financially? Is that an option for the city, laying off some folks, or is the city okay right now?
Our city remains strong. Our budget is strong. By the way, we'll talk a bit about this tomorrow in work session before our city council meeting. It'll be the 3rd or 4th time we've talked about it publicly since this all began. Our sales tax numbers for the last month are off about 5%. We did our contingency planning 60 days ago or so, and we estimated they'd be down 10%. So we're ahead of where we felt they would be. Certainly all options are on the table as we look forward, but Mr. Christian and I and our 5 other peers are very much involved on a day-to-day basis, understanding our finances, and we remain strong. And we're strong because we've made common sense financial decisions. We have a lot of cash. We have a strong balance sheet, and we remain committed to making good, I think, common sense decisions for our community.
Okay, thank you, Matt. Now we have Terry Furman, KLBK.
Good afternoon, everybody. Thanks for all that you all are doing. We certainly appreciate it. The question that I have is, those of us at home with small kids that maybe we're not a part of a pool somewhere, a private pool, are we going to expect the city pools to open? I know we have 4 of them, and I know we've talked about pools and, you know, the certain qualifications that they have to have. What about our city pools?
A good question, Terry. We will talk about that tomorrow in work session. We're posted to talk about city operations. I'm not certain that those decisions have been made yet, but we certainly owe everybody a call. We need to make a call on that, and the city manager will be briefing Mr. Christian, me, and the rest of the city council tomorrow on that topic.
All right, very good. Thank you. That's all I have.
Thanks, Terry.
Okay, now we have Sarah Self-Walbrick with Texas Tech Public Media.
Hi, everyone. Going back to the city council meeting, looking at the agenda, the disaster declaration is on there as well. Can you offer any insight on what y'all are thinking right now about either extending it or kind of what the plan is for going forward?
We'll bring ours in line with the governor's, Sarah. I don't expect there to be any, other than the language we've had in it all along. We'll run in concert with Governor Abbott.
Good deal. That's all I have as well.
Thanks.
Thank you, Sarah. And our last media question is Olga Aguero with El Editor.
Good morning. I know it's going a little past our time, but just quickly, 2 questions. How many tests have been given here in Lubbock County, a total amount overall?
Catherine, can you put your hands on that quickly? If not, I can pull it up.
If not, you can send it to me later on. And as for the mask, I totally agree. And whatever we need to continue doing to encourage everyone to wear a mask, what are the possibilities of maybe making people react more if we were to push for temperature checkings at these buildings? Because people go without a mask. How do we know, or how concerned should we be if they're running a temperature and going in to these facilities?
Well, I can help with that, Olga. The ability to test everybody that goes into a building is feasibly pretty difficult. Just having access to an appropriate and accurate temperature thermometer to be able to do that, and especially the infrared ones, where we don't actually have to touch a patient or touch an individual with a thermometer. Those are still a little bit scarce. They're a little easier to get now than what they were, but it would be exceedingly difficult. And so my encouragement to everybody is, if you're in a facility, in a place of where you purchase things, that you wear a mask, because social distancing is harder to do, although there's a way to do it. And I think the city of Lubbock is doing a pretty good job with that. And so that's the best way to do it. It's about social distancing, and wearing a mask is the best way not to catch the virus.
Thank you.
Olga, we've tested 10,000. We've done 10,254 tests as of late yesterday. Remember that stat, and the data I showed, as well as some demographic data, is all available at mylubbock.us. Click on the coronavirus tab, and we update those slides on a late every afternoon.
Okay, thank you.
Uh-huh.
Okay, thank you, Olga, and thank you all for joining us, and thank you to our panelists and to our interpreters. This concludes our news conference. We'll see you back Thursday morning at 11:30. So in the meantime, have a good week.